Master the essential principles of HIPAA basics to ensure compliance and safeguard protected health information. This course provides comprehensive training on the Health Insurance Portability and Accountability Act, HIPAA, emphasizing the importance of protecting patient privacy and maintaining confidentiality in healthcare settings. CNAs and healthcare workers will learn their legal responsibilities and practical strategies to ensure compliance. HIPAA is a federal law enacted to protect patients' health information and ensure privacy and confidentiality in healthcare. All healthcare workers, including CNAs, must understand HIPAA regulations to protect patients' rights and avoid legal violations. This course covers the core elements of HIPAA, patient rights, compliance guidelines, and CNA responsibilities for safeguarding protected health information. Introduction to HIPAA and its purpose. HIPAA, passed in 1996, is designed to protect patient privacy by regulating the use and disclosure of health information, provide patients with control over their health information, set standards for secure handling of health records, ensure healthcare workers understand their legal and ethical obligations. HIPAA applies to all healthcare providers, insurance companies, and their business associates. Protected Health Information, PHI, what it is and how to handle it. PHI includes any information that can identify a patient and relates to their health condition or treatment. Examples of PHI: name, address, phone number, social security number, medical history and diagnoses, treatment plans and medications, billing and insurance information. Healthcare workers must protect PHI by sharing information only with authorized personnel, securing physical and electronic records, avoiding discussions about patients in public or unsecured areas. Patient rights under HIPAA. Patients have specific rights under HIPAA, including right to access. Patients can view and obtain copies of their health records. Right to amend. Patients can request corrections to their records. Right to confidential communication. Patients can request privacy in how they are contacted. Right to an accounting of disclosures. Patients can know who has accessed their PHI. Healthcare workers must honor these rights and support patients in exercising them. Rules for healthcare workers: privacy, security, and confidentiality. Healthcare workers must follow these HIPAA rules. Privacy rule: limits use and disclosure of PHI without patient consent. Security rule: requires safeguards for electronic PHI, including passwords and encryption. Confidentiality: ensures PHI is kept secure and shared only with authorized individuals. Practical examples: log out of computer systems when not in use. Do not share passwords or leave records unattended. Use private areas for discussing patient information. Common HIPAA violations and how to avoid them. Common violations include discussing patient information in public areas, sharing PHI with unauthorized persons, losing unencrypted electronic devices containing PHI, failing to report breaches promptly. Avoid violations by being mindful of surroundings, confirming the identity of individuals before sharing information, following facility protocols strictly, reporting any suspected breaches immediately, using electronic health records, EHR, and HIPAA compliance. EHRs streamline healthcare but require strict compliance. Best practices: use strong, unique passwords. Access only records necessary for your role. Do not leave screens unattended. Report any suspicious activity or system errors. Reporting breaches and corrective actions. If a breach occurs, immediately notify your supervisor or the HIPAA compliance officer. Document the incident with details of what happened. Cooperate with investigations and corrective action plans. Follow up to ensure preventive measures are implemented. CNA responsibilities in maintaining HIPAA compliance. CNAs must Understand and follow HIPAA policies. Protect patient privacy during care. Avoid discussing patient information outside of professional settings. Secure physical and electronic patient information. Report potential or actual breaches promptly. Participate in ongoing HIPAA training. Conclusion and recap. This course has provided essential knowledge of HIPAA and practical guidance for CNAs to protect patient privacy and confidentiality. Upholding HIPAA standards is critical to maintaining trust and ensuring legal compliance in healthcare. Understand your fundamental protections and entitlements with this comprehensive guide to the Resident Bill of Rights. This course offers an in-depth understanding of the Resident Bill of Rights, emphasizing how CNAs and healthcare workers can uphold these rights to ensure ethical, dignified, and patient-centered care in healthcare and long-term care settings. The Resident Bill of Rights is a fundamental framework that guarantees the dignity, respect, and autonomy of residents in healthcare facilities. It outlines the legal and ethical obligations healthcare providers must follow to protect residents' personal freedoms and ensure quality care. This course explores the core components of the Resident Bill of Rights and provides practical guidance on how to implement and uphold these rights in daily caregiving. Introduction to the Resident Bill of Rights. A Resident Bill of Rights establishes the basic rights and freedoms every resident is entitled to in healthcare facilities, especially in long-term care. It ensures residents receive care that respects their individuality and protects them from harm. Key points. Overview of resident rights and protections. Importance of promoting a respectful and dignified care environment. The role of healthcare workers in safeguarding these rights. Legal and ethical foundations of resident rights. Resident rights are grounded in federal and state laws as well as ethical principles governing healthcare. Legal foundations. Federal laws such as the Nursing Home Reform Act. State-specific regulations and facility policies. Ethical principles. Respect for autonomy. Beneficence and non-maleficence, justice and fairness in care delivery. Understanding these foundations ensures caregivers provide care that is legally compliant and ethically sound. Key rights included in the Resident Bill of Rights. A Resident Bill of Rights typically includes rights such as right to dignity and respect, treated as an individual with respect and without discrimination, right to privacy, confidentiality of personal and medical information, right to freedom from abuse and neglect, protection from physical, emotional, and financial abuse, right to participate in care, involvement in planning and decision-making, right to make personal choices, freedom to choose daily activities, visitors, and schedules, right to voice grievances, ability to express concerns without fear of retaliation, right to quality of life, access to social, recreational, and cultural activities. Respecting privacy, dignity, and confidentiality. Respecting a resident's privacy and dignity is fundamental to upholding their rights. Practices to ensure privacy and dignity. Providing privacy during personal care and medical treatments. Keeping medical records and personal information confidential. Avoiding unnecessary exposure during bathing, dressing, or medical procedures. Using respectful language and mannerisms. Rights related to care, treatment, and informed consent. Residents have the right to receive proper medical care and treatment. Be informed about their condition and care options. Consent to or refuse treatment after being fully informed. Receive care that respects their cultural, religious, and personal beliefs. CNAs support these rights by providing information, respecting decisions, and reporting concerns promptly. Resident rights in decision-making and participation. Active participation empowers residents and enhances care satisfaction. Supporting participation. Encouraging residents to express preferences and make choices. involving residents in care planning and daily routines, respecting decisions about lifestyle, diet, activities, and healthcare. Preventing abuse, neglect, and exploitation. Protecting residents from harm is a critical aspect of respecting their rights. Recognizing abuse and neglect. Physical signs, bruises, burns, injuries. Emotional signs, withdrawal, fear, anxiety. Financial exploitation indicators. Responding to abuse. Reporting suspicions immediately to supervisors. Following facility protocols for investigation. Providing supportive care to victims. CNA responsibilities in upholding the Resident Bill of Rights. CNAs are frontline advocates for resident rights. Key responsibilities. Treat residents with respect and dignity. Protect privacy and confidentiality. Encourage resident independence and decision-making. Report any violations or concerns promptly. Participate in ongoing training on resident rights. Conclusion and recap. This course has equipped you with a thorough understanding of the Resident Bill of Rights and how to uphold these rights in healthcare settings. As a CNA, your role is vital in ensuring residents receive respectful, dignified, and person-centered care. Master the essential knowledge and legal requirements of mandated reporting to ensure you can protect those in your care. This course covers the legal requirements, responsibilities, and procedures for mandated reporting in healthcare. It prepares CNAs and healthcare workers to recognize abuse and neglect and to report these situations appropriately to protect vulnerable populations. Mandated reporting is a legal obligation for healthcare workers to report suspected cases of abuse, neglect, or exploitation involving vulnerable individuals such as patients, elders, or children. Timely and accurate reporting ensures the safety and well-being of residents and helps prevent further harm. This course details the types of abuse, legal responsibilities, reporting procedures, and CNA roles in mandated reporting. Introduction to Mandated Reporting. This module explains the purpose of mandated reporting, which is to protect residents from harm and to promote their safety and well-being. It highlights who qualifies as a mandated reporter under state and federal laws, emphasizing that failure to report suspected abuse can result in legal penalties for the healthcare worker. The module also discusses how mandated reporting fits into the broader scope of patient advocacy and healthcare ethics, reinforcing the role of CNAs as frontline defenders of resident rights. Types of abuse and neglect that must be reported. This module provides a comprehensive overview of various forms of abuse and neglect that CNAs must be vigilant about and report without delay. It covers physical abuse. Intentional use of physical force causing injury or harm, such as hitting, slapping, or improper restraint. Emotional or psychological abuse. Behaviors that inflict mental pain, distress, or anguish, including verbal insults, threats, humiliation, or isolation. Sexual abuse. Any unwanted sexual contact or behavior, including inappropriate touching or exploitation. Neglect. Failure to provide necessary care, food, shelter, hygiene, or medical treatment, leading to harm or risk. Financial exploitation. Illegal or improper use of a resident's funds, property, or assets. Self-neglect. When a resident is unable to care for themselves, leading to unsafe conditions or health risks. The module teaches how these abuses may manifest and why it is critical to report even suspicions to protect residents. Legal and ethical obligations and mandated reporting. This module explores the legal frameworks and ethical imperatives guiding mandated reporting. It explains legal requirements. Laws vary by state, but generally mandate healthcare workers to report suspected abuse to authorities immediately. Ethical responsibilities. Beyond legal duty, CNAs have an ethical commitment to protect vulnerable individuals, respect their dignity, and promote safety. Consequences of non-reporting. Failure to report may lead to legal penalties, including fines, loss of licensure, or criminal charges. Reporting timelines. Immediate reporting is emphasized to prevent further harm. Confidentiality and professionalism. How to maintain resident confidentiality while fulfilling reporting duties. Recognizing signs and symptoms of abuse and neglect. Recognizing abuse requires keen observation. This module details physical, behavioral, and emotional indicators. Physical signs. Unexplained bruises, burns, fractures, or injuries inconsistent with the explanation. Behavioral signs. Withdrawal, anxiety, aggression, fearfulness, or sudden changes in mood. Neglect indicators. Poor hygiene, malnutrition, dehydration, untreated medical conditions, or unsafe living environments. Financial exploitation signs. Missing belongings, unexplained withdrawals, or changes in financial status. The module also stresses the importance of documenting observations accurately, avoiding assumptions or accusations, and understanding that some signs may indicate medical conditions requiring professional evaluation. How to report. Step-by-step procedures. Clear, step-by-step guidance is essential. This module walks learners through 1. Immediate action. Ensure resident safety. Intervene if necessary. 2. Notify supervisors. Report suspicions promptly to a nurse or supervisor per facility protocol. 3. Complete incident reports. Fill out accurate and thorough documentation detailing the incident, observations, and actions taken. 4. Follow facility and legal protocols. Know where and how to submit reports to internal authorities and, when necessary, external agencies such as Adult Protective Services (APS) or Child Protective Services (CPS). 5. Cooperate with investigations. Provide truthful information and assist in follow-up reviews while maintaining confidentiality. 6. Maintain documentation. Understand the importance of keeping secure, objective records for legal and clinical use. Protections and confidentiality for mandated reporters. Fear of retaliation can deter reporting. This module covers legal protections. Most states provide immunity from civil or criminal liability for good faith reporters. Confidentiality requirements. Reporters' identities are generally kept confidential to protect them. Handling retaliation or workplace issues. How to seek help if retaliation occurs, including reporting to higher authorities or legal counsel. Ethical commitment to privacy. Reporting must balance protecting the resident and maintaining confidentiality for all parties involved. Common challenges and how to overcome them. Mandated reporting is not always straightforward. This module discusses barriers such as fear of consequences, concerns about job security or relationships with colleagues, uncertainty about signs, doubting whether an incident qualifies as abuse, lack of knowledge, not knowing how or where to report, emotional impact, difficulty confronting or reporting colleagues or family members, overcoming challenges. Training, support systems, clear protocols, and fostering a culture of safety and transparency are essential. CNA responsibilities and best practices in mandated reporting. This final module solidifies the CNA's role by emphasizing vigilance, continuously observing and assessing residents for signs of abuse, prompt reporting, acting quickly without delay or hesitation, accurate documentation, writing factual, clear reports, avoiding opinions or assumptions, respect and empathy, handling sensitive situations professionally while advocating for resident safety, continued education, staying informed about laws, facility policies, and ethical standards related to mandated reporting, collaboration, working with healthcare teams to ensure comprehensive protection and care. Conclusion and recap. This detailed course equips CNAs and healthcare workers with the knowledge and confidence to fulfill their mandated reporting duties effectively, protecting residents and fostering safe, ethical healthcare environments. Master the principles of scope of practice and delegation to ensure patient safety and professional accountability. This course provides comprehensive guidance on the scope of practice for CNAs, principles of delegation in healthcare, and how to maintain safe, legal, and ethical care while working collaboratively within healthcare teams. Understanding the scope of practice and delegation is crucial for CNAs and healthcare workers to provide safe, effective, and legally compliant care. This course explores the boundaries of CNA responsibilities, legal and ethical considerations of delegation, and best practices to communicate and collaborate effectively with supervisors and healthcare teams. Mastery of these concepts ensures quality care delivery and protects both patients and caregivers. Introduction to Scope of Practice. Scope of practice refers to the tasks and duties that healthcare workers are legally permitted to perform based on their training, certification, and state regulations. For CNAs, understanding this scope is vital to ensure safe, competent care without exceeding legal boundaries. Key concepts. Defining scope of practice. Differentiating CNA tasks from those requiring licensed personnel. Importance of adhering to scope for patient safety and legal compliance. Legal and ethical foundations of scope of practice and delegation. This module covers the legal frameworks and ethical principles underpinning scope of practice and delegation. Legal aspects. State laws and regulations defining CNA roles. Nurse Practice Acts and how they govern delegation. Liability and accountability in delegation. Ethical considerations. Respect for patient safety and dignity. Accountability in accepting or refusing delegated tasks. Transparency and honesty in communication. Understanding CNA roles and limitations. CNAs provide essential support in patient care, but have clearly defined limitations. Typical CNA responsibilities. Assisting with activities of daily living ADLs. Monitoring vital signs. Reporting changes in patient condition. Providing basic comfort and hygiene care. Limitations. CNAs do not perform invasive procedures or administer medications. Tasks requiring specialized nursing judgment or skills are outside the CNA scope. Understanding when to seek assistance or refuse unsafe tasks. Principles of delegation in healthcare settings. Delegation involves assigning responsibility for a task to another qualified person while retaining accountability for the outcome. Key principles. Right task. Delegating appropriate tasks within CNA scope. Right circumstances. Considering patient condition and setting. Right person. Assigning tasks to qualified individuals. Right direction or communication. Providing clear instructions. Right supervision or evaluation. Monitoring task completion and outcomes. Effective communication during delegation. Clear communication is essential for successful delegation. Strategies include providing detailed instructions about the task, clarifying expectations and patient-specific considerations, encouraging questions and feedback, reporting outcomes and any issues promptly, using standardized communication tools like SBAR, situation, background, assessment, recommendation. Responsibilities of delegators and delegates. Both parties in delegation have distinct responsibilities. Delegator, usually nurse. Assess patient needs. Choose appropriate task and delegatee. Provide clear instructions. Supervise and evaluate performance. Delegatee, CNA. Accept tasks only within scope and competence. Ask questions if unsure. Perform tasks safely and accurately. Report outcomes and any concerns promptly. Common challenges and solutions in delegation. Delegation can encounter obstacles such as unclear instructions, tasks beyond CNA skill level, communication breakdowns, resistance to delegation. Solutions. Seek clarification before accepting tasks. Communicate openly with the healthcare team. Participate in ongoing education. Use problem-solving approaches collaboratively. Best practices for CNAs in scope of practice and delegation. CNAs should know their scope and refuse unsafe tasks. Communicate effectively with supervisors. Document delegated tasks and patient responses. Stay informed of changes in regulations. Advocate for patient safety and quality care. Conclusion and recap. This course helps CNAs understand their scope of practice. It also covers the principles of delegation. This knowledge ensures safe, legal, and effective patient care. It's all about supporting teamwork and improving healthcare outcomes. Let's explore the incredible complexity and vital functions of the circulatory, respiratory, digestive, musculoskeletal, and nervous systems in a way that's easy to understand. This course provides essential knowledge of major body systems, including the circulatory, respiratory, digestive, musculoskeletal, and nervous systems. CNAs will learn how to understand these systems' anatomy and physiology, and apply this knowledge to providing effective patient care, recognizing conditions, and preventing complications. The human body consists of multiple systems that work together to maintain health and function. CNAs play a critical role in supporting patients with conditions affecting these systems. This course covers the structure, function, and disorders of the circulatory, respiratory, digestive, musculoskeletal, and nervous systems. By understanding the physiology of these systems, CNAs can provide informed, effective, and compassionate care to their patients. Introduction to body systems and CNA care. The human body is a complex organism made up of various interdependent systems, each playing a vital role in maintaining health and function. For CNAs, understanding these systems is essential because care decisions and interventions often relate directly to how these systems operate. Homeostasis, a critical concept where the body maintains internal stability, temperature, fluid balance, pH, despite external changes. CNAs must understand that illness or injury can disrupt homeostasis, necessitating attentive care. Interconnectedness of systems. For example, the respiratory system supplies oxygen to the circulatory system, which transports it to tissues. Dysfunction in one system often affects others. Role of CNAs. CNAs assist in monitoring and supporting these systems by performing tasks such as vital signs monitoring, assisting with mobility, providing nutrition, and reporting any abnormalities. Communication. CNAs are the eyes and ears of the healthcare team, so a solid understanding of body systems helps in recognizing subtle signs of decline or improvement. The circulatory system, structure, function, and CNA care. The circulatory system consists of the heart, blood vessels, and blood, responsible for transporting oxygen, nutrients, hormones, and waste products. Heart, anatomy, and function. A heart has 4 chambers, 2 atria and 2 ventricles that pump oxygen-rich and oxygen-poor blood throughout the body. CNAs should recognize the importance of this pumping action and how it affects organ function. Blood vessels. Arteries carry oxygenated blood from the heart to the body. Veins return deoxygenated blood to the heart. Capillaries facilitate exchange of gases and nutrients at the cellular level. Blood components. Red blood cells carry oxygen. White blood cells fight infection. Platelets help with clotting. Common disorders. Hypertension, high blood pressure, can cause strain on the heart and blood vessels, often asymptomatic but can lead to stroke or heart attack. Heart failure occurs when the heart can't pump effectively, leading to fatigue, swelling, and shortness of breath. Atherosclerosis. Plaque buildup narrows arteries, restricting blood flow. CNA care role. Monitor vital signs, especially blood pressure and pulse. Observe for swelling, edema, shortness of breath, chest pain, or cyanosis. Assist with mobility and positioning to improve circulation. Encourage adherence to prescribed diet and fluid restrictions. Report any new or worsening symptoms promptly. The respiratory system: structure, function, and CNA care. A respiratory system manages breathing and gas exchange, supplying oxygen to the body and removing carbon dioxide. Anatomy includes nose, mouth, pharynx, larynx, trachea, bronchi, and lungs. The alveoli within lungs allow for oxygen, carbon dioxide exchange. Breathing process. Inhalation brings oxygen-rich air into the lungs. Exhalation expels carbon dioxide. Common respiratory conditions: asthma, airway inflammation causing wheezing and difficulty breathing; chronic obstructive pulmonary disease, COPD, progressive airway obstruction leading to chronic respiratory distress; pneumonia, infection that inflames lung tissue, impairing oxygen exchange. CNA responsibilities: monitor respiratory rate, rhythm, and effort. Use pulse oximeters to track oxygen saturation. Assist with positioning patients upright to ease breathing. Encourage deep breathing and coughing exercises. Recognize signs of respiratory distress. Example: cyanosis, use of accessory muscles. Follow oxygen therapy guidelines as prescribed. A digestive system: structure, function, and CNA care. The digestive system breaks down food, absorbs nutrients, and eliminates waste. Anatomy and function: mouth begins digestion through chewing and saliva. Esophagus transports food to the stomach. Stomach mixes food with gastric juices for breakdown. Small intestine absorbs nutrients into the bloodstream. Large intestine absorbs water and forms stool. Common issues: gastroesophageal reflux disease, GERD, acid reflux causing discomfort; constipation, infrequent bowel movements due to diet, inactivity, or medication; diarrhea, frequent loose stools caused by infections or digestive disorders. CNA care: assist with feeding and monitor intake and output. Encourage fluids and fiber intake to maintain regular bowel function. Monitor for signs of nausea, vomiting, or abdominal pain. Assist with toileting and maintain dignity. Report changes in bowel habits or appetite. The musculoskeletal system: structure, function, and CNA care. The musculoskeletal system supports movement, stability, and protection. Components: bones provide framework and protection. Muscles facilitate movement. Joints connect bones and allow flexibility. Disorders: arthritis, joint inflammation causing pain and stiffness; osteoporosis, decreased bone density, increasing fracture risk; muscle atrophy, muscle wasting from immobility or illness. CNA role: assist with safe transfers and ambulation. Encourage range of motion exercises. Prevent pressure injuries through frequent repositioning. Monitor for pain or changes in mobility. Use proper body mechanics to protect self and patient. The nervous system: structure, function, and CNA care. The nervous system controls body activities, sensations, and cognition. Components: central nervous system, CNS, brain and spinal cord; peripheral nervous system, PNS, nerves connecting CNS to body. Functions: motor control, sensory input, coordination, and thought processes. Common conditions: stroke, disruption of blood flow to the brain causing paralysis or cognitive deficits; dementia, progressive loss of memory and cognition; Parkinson's disease, movement disorder caused by nerve degeneration. CNA care: assist with communication and mobility. Monitor cognitive status and behavior changes. Provide safe environment to prevent injury. Support ADLs with patience and empathy. Report any neurological changes immediately. Common conditions and diseases affecting each system. This module reviews frequently encountered diseases, their symptoms, and CNA care considerations across all systems. Emphasis on symptom recognition and timely reporting. Examples include hypertension, circulatory, pneumonia, respiratory, GERD, digestive, arthritis, musculoskeletal, and stroke, nervous. Case studies highlighting CNA interventions and preventive care. How CNAs support recovery and prevent complications. CNAs play a vital role in patient recovery by assisting with therapy exercises, promoting mobility and independence, preventing falls and pressure ulcers, encouraging nutrition and hydration, monitoring and reporting early signs of complications, providing emotional support and patient education. Conclusion and recap. By deeply understanding these critical body systems, CNAs enhance their caregiving effectiveness, ensuring patient safety, dignity, and improved outcomes through informed, compassionate care. This course provides in-depth knowledge of common diseases affecting the body systems and the essential responses required from CNAs. By understanding these conditions, CNAs can recognize symptoms early, provide the appropriate care, and help prevent complications to improve patient outcomes. Before diving into specific diseases, it's essential to understand how the body systems function and their interaction with disease processes. This module lays the foundation for the rest of the course. First, let's review the major body systems and why understanding them is crucial for CNAs. Circulatory, respiratory, digestive, musculoskeletal, and nervous systems. Each of these systems works together to maintain overall health. When any system is impaired, normal functioning is affected. For instance, heart disease impacts circulation, respiratory illnesses affect oxygen delivery, and neurological conditions can impair movement or cognition. Role of the CNA. Consequently, CNAs play a critical role in observing and responding to changes in these systems. CNAs act as the eyes and ears of the healthcare team, recognizing symptoms early and promptly reporting them. In addition, CNAs monitor vital signs, assist with activities of daily living, and ensure patient comfort. By understanding how diseases affect body systems, CNAs can contribute to treatment plans and help prevent complications. Overall, knowing body systems allows CNAs to provide better care, respond effectively to patient needs, and support the healthcare team. The circulatory system is responsible for transporting blood, oxygen, and nutrients throughout the body. Any disruption to this system can significantly impact health. Let's talk about some key diseases that affect the cardiovascular system. First, we have hypertension, or high blood pressure. It's often called the silent killer because people usually don't feel any symptoms, but it greatly increases the risk of heart disease, kidney damage, and stroke. Next is heart disease, which covers conditions like coronary artery disease, heart attacks, and heart failure. Common symptoms include chest pain, shortness of breath, and fatigue. Finally, we'll look at stroke, which happens when blood flow to the brain is blocked or interrupted. Warning signs include facial drooping, slurred speech, and sudden paralysis, often on one side of the body. So what should a CNA do? Here are some important responses. Regularly monitor blood pressure and heart rate. Assist patients with mobility and help them stay comfortable, especially if they're experiencing chest pain or fatigue. Support with medications as prescribed and encourage patients to stay compliant. Always be vigilant for signs of a stroke and report them immediately to the nursing staff. And lastly, educate patients on healthy lifestyle choices like eating a balanced diet, exercising, and avoiding smoking, to help manage blood pressure and prevent heart disease. As a CNA, your careful attention can make a big difference in catching early warning signs and keeping patients safe. The respiratory system is responsible for exchanging gases between the body and the environment. Conditions affecting this system can compromise oxygen delivery and lead to respiratory distress. Now, let's move into one of the most common chronic respiratory conditions you'll encounter as a CNA. This condition slowly worsens over time and can make even simple activities like walking or dressing very difficult for patients. Chronic obstructive pulmonary disease, or COPD, is a progressive disease that restricts airflow and causes breathing difficulties. Symptoms often include shortness of breath, persistent coughing, and excessive mucus production. Another respiratory condition you'll often hear about is asthma. Asthma is a chronic condition where the airways become inflamed and narrowed, making it hard to breathe. Common symptoms include wheezing, persistent coughing, and a feeling of chest tightness. Finally, let's talk about an acute condition that can be life-threatening if not addressed quickly. This infection can strike people of all ages and often requires immediate medical attention. Pneumonia is an infection of the lungs that causes inflammation and fluid buildup. Symptoms include cough, fever, chills, and significant difficulty breathing. Understanding respiratory diseases like COPD, asthma, and pneumonia is essential for CNAs. By recognizing symptoms early, assisting with treatments, and supporting patients' breathing and comfort, you play a vital role in their care and recovery. Now let's go over how CNAs can respond to patients with respiratory issues. First, always monitor the patient's respiratory rate and oxygen saturation levels to ensure they are stable. Next, assist with position changes that make breathing easier. For example, placing COPD patients in a semi-Fowler's position. Additionally, encourage patients to perform deep breathing exercises, which can help improve lung function over time. When supplemental oxygen is prescribed, administer it correctly and make sure the equipment is working properly. You may also need to assist patients with coughing and clearing secretions if necessary. Finally, be vigilant and immediately report any signs of respiratory distress, such as increased shortness of breath or bluish discoloration, also known as cyanosis. The digestive system breaks down food for nutrient absorption and eliminates waste. Disease in this system can cause significant discomfort and affect overall health. Let's look at some common digestive system conditions that CNAs often encounter and how to respond effectively. Gastroesophageal reflux disease, or GERD. This occurs when stomach acid frequently flows back into the esophagus, causing heartburn and discomfort. Common symptoms include regurgitation, chest pain, and difficulty swallowing. Irritable bowel syndrome, or IBS, a disorder that causes abdominal pain, bloating, and either diarrhea or constipation. Triggers can include certain foods, stress, or hormonal changes. Constipation. This is difficulty passing stools, which can result in infrequent or painful bowel movements. Causes may include poor diet, dehydration, medications, or other health conditions. CNA responses encourage a high-fiber diet and proper meal planning. Promote adequate fluid intake to prevent constipation. Assist patients with prescribed medications and monitor effectiveness. Teach strategies to reduce GERD symptoms, like elevating the head during sleep and avoiding trigger foods. Report any changes in bowel habits, appetite, or abdominal pain to the nursing staff. By understanding these digestive conditions and responding properly, CNAs help maintain patient comfort and prevent complications. The musculoskeletal system supports movement and protects vital organs. Musculoskeletal disorders often affect mobility and quality of life. Key diseases. Arthritis includes osteoarthritis and rheumatoid arthritis, causing joint pain, stiffness, and swelling. Patients often have a limited range of motion. Osteoporosis, a condition where bones become weak and brittle, increasing the risk of fractures. Often patients don't notice symptoms until a bone breaks. Fractures, breaks or cracks in bones caused by trauma or weakened bones. Symptoms include pain, swelling, bruising, and limited movement. CNA responses. Assist with physical therapy and rehab exercises. Ensure safe transfers and walking using assistive devices. Monitor joints for swelling, pain, or deformity. Help patients use canes, walkers, or other mobility aids properly. Provide emotional support for chronic pain or limited mobility. By understanding these musculoskeletal conditions and responding appropriately, CNAs help patients stay safe, mobile, and comfortable. The nervous system controls body activities and processes sensory information. Diseases affecting the nervous system can impair cognition, movement, and autonomic functions. As a CNA, it is important to recognize common neurological conditions that affect patients. These diseases often impact mobility, communication, and cognitive function, requiring specialized care and attention. Stroke, sudden disruption in blood flow to the brain, leading to brain cell death. Symptoms include one-sided weakness, difficulty speaking, and confusion. Parkinson's disease, a progressive neurological disorder that affects movement and coordination. Symptoms include tremors, rigidity, bradykinesia, slowness of movement, and balance issues. Dementia, a decline in cognitive function, including memory, thinking, and judgment. Alzheimer's disease is the most common type. CNAs play a vital role in supporting patients with neurological conditions by ensuring safety, assisting with mobility, and providing emotional and cognitive support. Assist with physical therapy and encourage mobility exercises. Provide cognitive stimulation and support daily activities for dementia patients. Monitor for changes in mental status or motor function and report to nursing staff. Ensure patient safety by preventing falls or injuries, especially in those with movement disorders. Understanding key neurological diseases and appropriate CNA responses is essential for providing safe, effective, and compassionate care. By recognizing symptoms early and supporting patients with both physical and cognitive needs, CNAs play a vital role in maintaining quality of life and ensuring patient safety. This module provides a detailed review of the most common diseases affecting the circulatory, respiratory, digestive, musculoskeletal, and nervous systems. It emphasizes the early signs and symptoms to help CNAs recognize complications early and report them promptly. We will focus on two essential skills: symptom recognition, understanding how to distinguish between normal age-related changes and abnormal signs that indicate illness or injury. Reporting protocol, learning the correct methods for documenting and promptly communicating changes in a patient's condition to the healthcare team. By mastering these skills, CNAs can provide safer care, support the healthcare team effectively, and improve patient outcomes. CNAs play an essential role in the recovery process by assisting patients with rehabilitation, promoting mobility, ensuring comfort, and preventing complications. Supporting recovery, assist with exercises and ROM activities, encourage positivity and daily engagement, preventing complications, monitor for infection, swelling, or worsening symptoms, prevent falls, pressure ulcers, and immobility issues, educate patients' families on lifestyle changes. This course has equipped CNAs with essential knowledge of common diseases affecting body systems and practical strategies for providing care. By understanding the anatomy, symptoms, and appropriate responses to these conditions, CNAs can improve patient outcomes, prevent complications, and provide compassionate, effective care. This course equips CNAs and healthcare workers to recognize early warning signs of critical medical emergencies affecting major body systems, respond appropriately, and communicate effectively to ensure timely intervention and patient safety. Medical emergencies demand fast, accurate assessment and action. CNAs, by virtue of their continuous patient interaction, are uniquely positioned to detect changes early. Understanding emergencies. First, it is important to differentiate urgent situations from non-urgent ones. While some changes may simply require routine reporting, others demand immediate attention and rapid intervention. Legal and ethical considerations. Next, CNAs must remember that their role is guided by both scope of practice and facility procedures. This means acting quickly, but never performing tasks outside of training, ensuring both patient safety and legal protection. CNA responsibilities. In practice, CNAs are expected to maintain vigilant observation of patients, watching closely for any changes in condition. When abnormal signs extend beyond normal care, the CNA must recognize them as potential emergencies. At that point, the correct response is to follow protocols, calling for help immediately, and providing only the basic support allowed by training until more advanced help arrives. In short, medical emergencies demand calm, quick, and correct action. By moving smoothly from recognition to reporting to basic support, CNAs serve as the first line of defense in patient safety. Transitional thinking, observe, recognize, act, is what makes the CNA's role in emergencies so vital. Stroke occurs when blood flow to the brain is interrupted, causing brain damage. Rapid recognition is crucial to reduce lasting effects. Types of stroke. First, it is important to understand that there are two main types of stroke. Ischemic stroke, which occurs when a blood clot or blockage interrupts blood flow to the brain. Hemorrhagic stroke, which happens when a blood vessel in the brain ruptures, causing bleeding. Although the causes differ, the outward signs may look very similar. Common signs, the FAST method. Next, CNAs should remember the acronym FAST, which highlights the most common and recognizable signs of stroke. Face drooping. One side of the face may appear weak, numb, or droop. Arm weakness. The person may be unable to raise one arm, or one arm may drift downward. Speech difficulty. Speech may sound slurred, strange, or hard to understand. Time. If any of these signs appear, it is critical to call emergency services immediately. Using FAST helps CNAs act quickly and decisively. Additional symptoms. In addition to FAST, stroke may also present with other sudden changes such as confusion or difficulty understanding, blurred or double vision, severe unexplained headache, loss of balance, dizziness, or poor coordination. Recognizing these warning signs is just as important because not all strokes look the same. CNA response. Once stroke is suspected, the CNA must act without delay. First, activate the facility's emergency response system. Then, keep the patient safe and comfortable, but do not give food or drink, since swallowing may be impaired. If trained, monitor vital signs and report them immediately. At the same time, offer reassurance to reduce fear and anxiety. Finally, document the exact time symptoms first appeared, since this information is critical for medical treatment. A myocardial infarction results from blocked blood flow to heart muscle, leading to tissue death. Common signs. First, it is important to be familiar with the most frequently reported symptoms. A patient may complain of chest pain or pressure, which can radiate to the jaw, neck, or arms. This is often accompanied by shortness of breath, cold sweats, nausea, or lightheadedness. Some patients may also report unusual fatigue or sudden weakness, which should not be ignored. Atypical signs, especially in women and the elderly. In addition to the classic symptoms, certain groups may present with less typical warning signs. For example, women and elderly patients may experience jaw pain, back pain, or discomfort that feels similar to indigestion. Because these signs can be overlooked, CNAs must stay alert and report them promptly. CNA response. Once warning signs are observed, the CNA must act immediately. The first step is to call emergency services without delay. Next, assist the patient into a comfortable position, often sitting upright, to reduce strain on the heart. Loosen any tight clothing to make breathing easier and continue to closely monitor the patient's breathing and pulse. Be prepared to initiate CPR if the patient becomes unresponsive and facility protocol allows. It is equally important to remember what not to do. Never give the patient food or fluids, as this could complicate emergency care. Instead, stay calm, provide reassurance, and avoid unnecessary movement. Finally, document and communicate the time the symptoms began, as this information is vital for medical staff. Respiratory distress occurs when patients cannot breathe adequately, reducing oxygen supply to the body. Signs of distress. To begin with, respiratory distress often shows through noticeable breathing changes. These may include rapid, shallow, or labored breathing. In addition, patients may use accessory muscles of the neck and chest to help them breathe. Furthermore, cyanosis, a bluish color of the lips, face, or extremities, is a serious indicator that oxygen levels are dangerously low. Other warning signs can include nasal flaring, wheezing, anxiety, restlessness, or confusion. Common causes. Next, it is important to understand what may trigger respiratory distress. For instance, asthma attacks and COPD exacerbations are frequent causes. Likewise, pneumonia may impair normal breathing, while choking can suddenly block the airway. Recognizing these underlying causes helps CNAs respond appropriately and promptly. CNA response. When signs of respiratory distress appear, CNAs must act quickly. First and foremost, notify the nurse or emergency team immediately. Then, assist the patient into a position that eases breathing, usually sitting upright. If trained and the patient has an oxygen order, administer oxygen as prescribed. At the same time, monitor vital signs closely and encourage the patient to take slow, deep breaths if they are conscious. Finally, ensure the airway is clear, and if trained, assist with suctioning when necessary. In short, recognizing respiratory distress means observing breathing difficulties, skin color changes, and behavioral signs. By combining quick action with clear communication, CNAs play a crucial role in preventing further decline and supporting life-saving treatment. In addition to breathing problems, CNAs must also recognize other critical emergencies such as shock, seizures, and sudden changes in mental status. These conditions can develop quickly and require immediate action. Shock. When the body is not getting enough blood flow, signs may include pale or clammy skin, a rapid pulse, low blood pressure, confusion, and overall weakness. Because shock can be life-threatening, it requires urgent medical attention. Seizures. A seizure may appear as sudden, uncontrolled body movements or a loss of consciousness. During this event, the CNA should focus on protecting the patient from injury by moving nearby objects out of the way. It is important not to restrain the patient's movements, as this can cause harm. Altered mental status. Sudden confusion, agitation, or decreased responsiveness can signal a serious problem such as an infection, medication reaction, or neurological issue. Recognizing these changes quickly can prevent further complications. CNA response. In each of these emergencies, the CNA's role is to stay with the patient and ensure safety while immediately reporting the situation to nursing staff. Careful documentation of what was observed is also essential for proper medical follow-up. Emergencies in healthcare settings demand quick thinking and confident action. Emergency activation. First and foremost, you must know how and when to activate the emergency system. This could mean calling a code within the facility or dialing outside emergency responders. Quick activation ensures that advanced help arrives without delay. Basic life support, BLS. If you are certified in BLS, you may be called upon to assist with CPR or help maintain an open airway until licensed staff take over. Even if you are not performing compressions, your role might include bringing the crash cart, positioning equipment, or ensuring space for the resuscitation team. Safe patient handling. In emergencies, it is tempting to move the patient quickly. However, avoid unnecessary movement unless safety demands it, such as in a fire or if the patient is choking. Always prioritize protecting the airway and maintaining spinal alignment if trauma is suspected. Communication. Equally important is timely and accurate communication. Relay vital signs, observe changes, or patient statements to the nurse or emergency team immediately. During high-stress moments, being calm and precise prevents confusion and ensures the team acts effectively. Emotional support. Finally, never underestimate your role in providing emotional support. Offering reassurance to patients helps reduce fear, while comforting families fosters trust and calm in the middle of crisis. Your presence can make a frightening situation more manageable. CNAs must stay calm, activate the emergency system promptly, support the healthcare team, and ensure patient safety and comfort until advanced help arrives. In emergency situations, effective communication and accurate documentation are crucial. First, CNAs must focus on clear and concise reporting, using objective language that describes what was observed, such as specific signs, symptoms, and the timeline of events, rather than personal opinions or assumptions. To ensure smooth handoffs, tools like SBAR, situation, background, assessment, recommendation, help organize information quickly and effectively. At the same time, timely and accurate documentation supports continuity of care and provides legal protection. Finally, even under pressure, CNAs must maintain confidentiality, safeguarding the patient's privacy at all times. Preventing emergencies is just as important as responding to them. CNAs play a vital role in keeping patients safe by watching for early warning signs, teaching healthy habits, and working with the care team. Prevention starts with regular vital sign checks, allowing CNAs to spot early signs of distress. Through patient education, aides can encourage treatment adherence and healthy lifestyle choices that reduce risks. Safety is also key. Fall prevention strategies protect vulnerable patients from emergencies. Beyond that, CNAs must practice ongoing observation, noticing even subtle condition changes. Finally, collaborative care with nurses, therapists, and physicians ensures the best outcomes for patient health. By mastering recognition of distress signs and appropriate CNA responses, healthcare workers become critical links in the chain of survival and patient safety. Early detection and prompt action save lives and improve patient outcomes.